decided to do a training video here for you. First transfer a lot of people are doing are the bed-to-bed transfer when a patient comes back from surgery, or this is also for when you got to scoot the patient across the bed. When you grab the sheets, you want to grab them with your arms, with your hands up, an underhanded grip, not an overhanded, okay? This is using much weaker muscles. This is much stronger muscles. And you want to stagger your feet and you shift your whole body. I'm going to scooch sideways a little bit. Okay? Like that. The only time you use an overhanded is if you're helping roll a patient and you're grabbing the sheet on the other side because your elbows don't bend the other way. It's true. But you also want to counterbalance yourself. I actually kick my leg out. You ready to roll? Okay? Like that. And then I keep my leg up against the bed so the patient doesn't feel like they're going to roll plumb out. Okay. When you're scooting a patient over, you want to stagger your feet so you can shift your whole body weight. The only time your feet are side by side, I'm going to use you now. Come in. Is when you're scooting the patient up in bed. Yeah. This is a very professional video. You're going to have the patient help you. Okay, go ahead and cross your arms for us, please, and go ahead and bend your knees up. On the count of 3, you're going to push with your legs, okay? 1, 2, 3. You hit the head. Okay, so that's when you have your legs straight across and you're shifting your whole body weight. Always remember to pull your tummy in tight. With our larger patients, to scoot them up in bed, tip the bed up on its head. Let gravity help you. Okay, now we're going to do transferring out of bed. For all of the neck patients and the lumbar patients, they need to do the log roll to get out of bed. So roll to the side for the neck patients. Please put the head of the bed all the way down. Don't let them cheat with it up. Actually, for the lumbar patients too, but we see it more with the neck patients. Once they're sitting, okay, her feet are not on the floor, so her back is not very comfortable and she's feeling pretty unsteady right now, aren't you? All right, so I'm going to have you scooch forward, and if you kind of inch one booty cheek forward and then the other. There you go. Good. Now it's easier for everybody to stand up if they're scooted forward. They certainly don't want to feel like they're all the way off the bed. No sliding off the bed. Okay, the gait belt. Most of the time, we're going to have it around their waist. The only time we do not have it around their waist and we have it around their chest is if it's a lumbar patient that does not have a brace because they don't like your fist in their incision. Or sometimes they just don't fit over the brace well. Okay. All right, so we tell them have one hand on the walker, and it's usually the hand that has the IV in it, but they want to push off the bed with the other hand. Because what happens when you pull up on both sides of the walker? It tips. Okay. And there you go. Yeah.
Good correction.
Good correction. All right, go ahead and turn. There you go, and I'm going to have you back all the way up. Like that. Really feel the chair on the back of both of your legs. Reach back with at least one hand. Aim back and have a seat. Whenever you grab the gait belt, again, you're grabbing with an underhand, not an overhand. Okay, getting out of the chair. Again, go ahead and scoot forward, kind of waddle forward. Some patients will say it's twisting. It is not. All right, please keep one hand here. Go ahead and come push on up. For walking, you're going to be behind and off to the side a little bit. All right, steady? Mm-hmm. Any dizziness or lightheadedness? No? Okay, bathrooms that way. Kind of guard with your hand here in case they lose their balance. And then you pull them into you if they do. I kind of put my leg up against her, and she steadied herself, and we're good. Because falling is an incident report. We don't want to do. All right, now we're going to show you how to use the sit-to-stand lift to use the sit-to-stand lift, the patient has to have some activity in their legs. They have to be able to use their legs. If they're completely flaccid, have absolutely no strength in their legs, you can't really use the lift because the patient has to help. These slings, they live above inpatient 2. They are one patient use. Some of our patients already use the sit-to-stand at home, so when they're done with them, I ask them if they want to take their sling home with them. If not, we gotta trash it. All right, let's go ahead. This is always more than one person job. You need to widen the legs out, which is on the remote.
Thank you.
Did you bump the button?
No,
Okay. Yes, you did.
I did.
So if, this is actually a good example, good job. If anybody leans against this and it suddenly won't work, there is a red button right here. It's the emergency stop. You want to make sure that it's not pushed all the way in, because if it does, it won't work. You got to turn it and let it back out. And now it works. All right, so you bring it right on in. Lean forward for me a little bit. And this is basically a big old belt. There's pads on here that you'll see comes under the patient's armpits. And there's a Velcro strap. Goes around their tummy. All right, this is a lift that the patient helps with. So can you get your feet on the plate down there? There you go. Sometimes you need to help them lift up. And then their knees are going to be against this pad here. Go ahead and lock the wheels. You can't see it, but there's foot locks down there. And then there's loops here that you can pick which color. We'll go yellow. And you hook it on there. I double hook. Okay, now you ask the patient, can you hold on here? And you're going to use your arms here. Yep, however, whatever grip you feel most comfortable with. And as this starts to lift you up, you're going to use your arms and come help. Okay? All right. Kind of go up little by little. It's going to be kind of freaky. And you're pushing with your legs and helping. There you go. Like I said, they have to have some activity in their legs. All right. It's always a good idea for somebody to be hanging on to the patient because it's kind of freaky for them. Turn. Well, you don't want to close them too much because she's still in it.
Right.
You got to turn. And then you got to play with this kind of bed. The old beds you got to bring up. There's a little notch that it will fit. Just barely. It's much better on the new beds. They fit under the new beds. All right, as you sit, go ahead and hook your booty out. Sit back as far as you can. Bring it down until you can get good slack in the line so you can get the sling off. Alright, can you pick your feet up off the plate? You want to make sure they have their feet up so you don't drag them right back off the bed. And then they're going to do the log roll to lay down. So go ahead and go clear down onto your side. If you need to help them with the legs, you just help them with the legs. And position them on their side or their back as they feel comfortable. Okay, the Hoyer lift. Fortunately, we do not have to use this here on the floor very often, but there are times that we need to. Hopefully the patient is coming to you that they're already laying down. If they're in the chair and they happen to have their own Hoyer sling, the process is pretty much still the same. So this is always a more than one person job. So my lovely assistant, come on over. So the first job is to get the sling under the patient. So hopefully this is pretty self-explanatory. This higher part is goes under the head, and then the leg parts here, this is actually, these crisscross underneath the legs. So I'll roll her towards me first.
Bring it up first.
Yes.
Is that on my back?
Yes. So anytime you're doing anything like this with somebody, you want to, you know, we're not all the same height, but you want to try to find a good height so not everybody's bending over. Okay, so Miss Pollard, can you bend this knee up for me, and you're going to roll towards me. And again, I'm keeping my leg and my body up against the bed just so she feels more secure. Okay, roll on back. All right, come on back. And then these legs, you're going to crisscross them. Okay, because these slings are designed to help get a patient onto the commode, onto the toilet. So now the Hoyer lift, you kind of can't see it, but to get the legs apart, you can barely see the handle here. It's a manual, it's not an automatic. So with these, with the old beds, the Hoyer does not fit nicely underneath. Can we go ahead and put the bed down?
Sure can.
So you kind of have to come in sideways a bit. And honestly, you just kind of do the best you can because the wheels are going to get stuck. So this is as far as I can get. So you tell the patient they are going to swing a little bit, but we're going to help control you. Old beds versus new beds. Yeah, I'm going to try to go on the red. Again, personally, I always like to try to double strap if I can. And being in a Hoyer, if you have never been in a Hoyer sling yourself, it's scary.
It is.
Because you are totally not in control on the red.
There. Oh, there. And then we have it to look like that.
Yes, and a double loop. Okay. And again, I usually kind of come up little by little, make sure it's hitting them where it needs to be. All right, so she's kind of starting to slide. I'm just supporting. Kelsey, if you can grab her feet and turn her so that she's... Right, and then go ahead and let her knees bend. And then you got to watch their knees and their feet so that you can get around that center pole. Yeah. All right, now when you're getting somebody into a chair or into a wheelchair, in a wheelchair when you're lowering them down, if you actually pop a wheelie on the wheelchair, you can get their butt all the way back and not have to manhandle and pull them back. But getting into a chair, if you just kind of, as she comes down, if you kind of grab the sling here and pull her booty back, because otherwise her shoulders will hit the chair first. Coming on out so that we don't whack your head. She's down in the chair. The process for getting back into bed is the same because you do not worry about trying to get the sling out from underneath him in the chair. Okay, so the sit-to-stand lives down here on inpatient 2 by 28 in the blanket warmer. When you put it away, it goes in this little slot. It needs to be back in because this guy does live plugged into the wall. The Hoyer is not plugged in, but the battery pack is. If you try to put it in the other way, it's really inconvenient to try to get it unplugged and plugged, but it also pulls the cord enough that it won't charge the battery.